My name is Dr. Modupe Tunde Bias. I'm an obstetrician and gynecologist working at North York General Hospital. Today, we're talking about the effect of the COVID-19 infection, especially in younger people and our population of pregnant women.
The question of safety is on everyone's mind. Is the vaccine safe? It's something we want to know and our patients want to know. We actually know a lot about vaccines in general that give us a lot of confidence about the safety of the COVID vaccine in particular. Furthermore, there's tons of real-world evidence now of pregnant women who have chosen to get the vaccine, and we know from that experience that there's no concerns for safety. And there's also now some good scientific evidence that the vaccine in pregnancy appears to be extremely safe. The vaccine that you should get is the first one that you have available to you. Get whatever vaccine you can. All of them have been seen to be very, very safe for people in general and for pregnant women as well. Recently, in this most current wave with the new variants, we're seeing a lot more patients coming in a lot sicker and a lot younger. And specifically for pregnant women, it's really affecting them hard. I've seen patients in the ICU who are extremely sick, and I've seen babies being affected because they're having to deliver early because their moms are so sick.
My doctor, my OB, is Dr. Elad Meidan, and he's been amazing. I asked him in my first trimester if I should get the vaccine, and he was very helpful. He said that, there's not very much information, but I think you should get it. It's important because what's happening right now is that a lot of pregnant people are, ending up in the ICU, and everybody's contracting these variants, but these vaccines are helping.
We know that when you take the COVID vaccine, 2 weeks later, your body produces an immune reaction that prevents you from getting very sick with COVID, hospitalized, or put into the intensive care unit. We know that. We've been vaccinating our pregnant patients for decades with influenza vaccine, with pertussis vaccine, and we've been doing it for the purpose of getting our babies to be immune at the time of delivery by vaccinating the mother while she's pregnant. So for COVID vaccine, 2 weeks after you take this shot, and we really recommend that you do, your body will produce antibodies that go right through your bloodstream and the placenta to your baby. We don't think that the COVID vaccine has any effect whatsoever on the DNA that's in your body. DNA is in your cells, and the COVID vaccine goes under your skin and produces an antibody response in your bloodstream. It helps you fight the virus if you come in contact with it, but the vaccine has no effect whatsoever on the DNA that are in your cells. The medical community and the scientific community that have studied this vaccine so carefully, now in hundreds of millions of people worldwide, do not think this vaccine can hurt your baby.
The third trimester is the most dangerous time for pregnant women if they contract COVID. They're at a higher risk for being admitted to hospital, for requiring ventilation, for being admitted to the ICU. So it's very important that you seek getting the vaccine in the third trimester. Some of my patients come to me and ask, I'm in my first trimester, should I be getting a vaccine or waiting till I get past that first trimester? And the answer is really no, don't wait. You should be getting your vaccine as soon as you have access to it. We want you to be protected as soon as we can to make sure that you're healthy throughout your pregnancy.
So the vaccine has been developed so quickly, and many of my patients ask, why is that? This mRNA technology has been around for a longer time, more than 10 years. Because this is a pandemic, we need to react very quickly. So scientists and researchers all over the world put all their hands on deck to ensure that the vaccine is produced as soon as possible. And I tell my patient that this is nothing new, and they need to get the vaccine as soon as possible.